Hey, aloha gang, Dr.Russ Rosen here, and welcome to the OHC community. We're diving into the doctor's examination. It looks like it's going live. I always have to check because sometimes it doesn't. And we're going ahead and checking right there. Not showing up yet because we know there's a delay. I think if you know Zuck, talk to him, tell him we can maybe fix that delay issue. Cool, there we are. We're happening. All right, so if you happen to be out there, go ahead and let me know who you are and where you're from. If you have questions along the way, let me know. I will give my wrap and then I'll dive into any questions. Again, today we're going to be talking about the doctor's examination. And uh, again, if you don't know me, I help doctors thrive in a care versus care true optimal health model. You want to help your patients get healthy and stay healthy for a lifetime versus just getting out of pain. You want them to happily stay paid and refer for a lifetime. I can help you do it. Please let your colleagues know. 3 Tuesdays a month, 1:30 California time. We're right here doing this. If you go to the guides section, we've got several versions of this already pre-recorded. Again, happy to answer any questions along the way. So we're diving into the patient examination, and here's what I know to be true. We really want our patients to understand the value of our care. We want them to understand how different we are, right? You're a seahorse in a land of sawhorses. If you want to help people get healthy and stay healthy for a lifetime versus just out of pain, and you're a natural healthcare provider, you separate yourself from the herd. But our concerns are, so many of us get so frustrated because we don't want to spend too much time. We want to spend just the right amount of time. We don't want to overwhelm our patients with information because their eyes glaze over and they start to drool, right? Have you ever seen that? Have you ever seen your patient's eyes glaze over and they start to drool? Yes, you have. And if you have seen that, the bad news is you caused it. But what's the good news? You caused it, so you can fix it. You can do something about it. So what I want to do is I want to help them get the bigger picture of what it is that we're doing for them, how we're able to help them. And where we can best educate them is during the examination. Now, last week during the consult, we talked about we're going to draw their story out of them, then we're going to apply our story to their story. We're not going to try and teach them about chiropractic or brain work or acupuncture, whatever it is that you do, nutrients or emotional work, whatever. We're not going to try and cram it down their throat. We're going to draw their story out of them and we're going to apply our story to their story. We talked about that last week. Now's when we really get to educate them. So again, I put in chat, what are things that we should be as a natural health, as a doctor, trying to accomplish during an examination? And again, I'm always shocked with the answers because I agree. These are things we should be doing. Most of us out there aren't doing these things, and God knows most of the medical profession that I've seen doesn't do anywhere near this. Okay, so what are some things? Well, number one, it says to get a holistic understanding of what's going on with them. Yes, this is the time to educate. This is the time to find out the depth of what's going on. We do it in the consult, but I really want to dive in deep during the exam. This is where I can touch them and talk about specifically what's going on and dive deeper into that conversation. I can make it real to them. So this is what I want to be able to do. Now, when I was in chiropractic school, I did a management course with a guy I really loved. So I won't mention his name because I didn't agree with this particular part. But he said during the examination, get a cassette recorder back in the day, and let them know that I'm going to be recording. So I'm going to ask you to be silent. And then just go through and start saying, range of motion this and posture that and subluxation here and blah, blah, blah. No, this is the time to dive deep, have a conversation, make it real for them. But I want to do it by design, and I want to be able to do it in a very short period of time. We don't need to waste a lot of time if when we're playing darts, we only throw bullseyes. The second thing it said was early detection. Absolutely, this is our wheelhouse, right? We want to get to the underlying cause. We want to help them resolve their problems versus just masking their symptoms or treating their symptoms. Yes, this should happen, and we should be figuring this out during the examination. Preventative care. Yes, this is our wheelhouse. This is who we are. This is what we do. A personalized treatment plan or care plan. Yes, absolutely. Let me see. Okay, good. Dr. Joseph, good to see you, brother. That just popped up. Um, Building trust. Yeah, we want to build trust right off the bat, but when we get their hands on them, that's when they know they're in the presence of a master, when we're able to tell them everything but their mother's maiden name. Continuity of care. Detailed examinations create a complete medical record, which is essential for ongoing care and monitoring of chronic conditions. Yes, this is the Achilles heel of many of us natural health care providers, because we do a great exam, we do great reported findings, but then we never follow up with reevaluations and re-reports, so we're not having continuity of care. But it all starts right here, doing a great examination that they understand, right? So I want to be able to add this. I want to be able to add this concept that, remember, we're using the neuroscience of communications, right? And during the neuroscience of communications, we can teach under the radar. So I'm not lecturing at you about what subluxations are. If I'm a chiropractor, I'm able to make it real for you in real time. I'm going to show you how we do that. So in the doctor's examination, there are 3 steps to the doctor's examination. The first one is the transition from the consult to the exam, where I get my hands on them. I'll be going into details about that in the club this Thursday. If you'd like to join in the club this Thursday, 11 o'clock California time, you're welcome. I'll give you a free month in the club. You can go see all the recordings that we have. You can download things like this and this, etc. And if you're happy, stay. And if you're not, leave. Doesn't cost you a penny. So we're going to be going through that, of how to transition from the consult into the examination on Thursday. We're then going to do the examination with our hands-on examination, and then we're going to transition out of the examination. Okay, and again, I'll be going through that, but right now we're just going through the hands-on. So I want to show you how simple this can be. There's a phrase I would ask you to remember. Obviously, customize it, make it your own. Here's how I do it. Oftentimes, if you have a subluxation causing blank, we'd expect to see blank, and that would make sense because blank. Write that down. Oftentimes, if you have a subluxation causing blank, we'd expect to see blank, and that would make sense. Or is that going on with you? Yes. Well, that would make sense because blank. Now, obviously, if you're talking about nutritional deficiencies, you wouldn't say subluxation. If you're talking about neuroemotional, you wouldn't say, like, whatever it is you do. So obviously, if you have, oftentimes if you have this going on, we'd expect to see blank. Is that going on with you? Okay, well, that would make sense because, and we need to make it make sense to them. So we're going to connect. I'm going to do it as if I'm a chiropractor and I'm talking about a subluxation. So let's assume they have headaches right here. Okay, so I'm going to go ahead and I'm going to touch right there. Now, is this going to give me any real data, any information? Is it going to be softer here or harder or hotter? No, but I want them to know I know. So I'm just going to say, oftentimes, and I'm going to palpate, if you have a subluxation causing these kinds of headaches, we would expect to see a tender spot there. Is it tender there? Yes. Well, I think we may have found the underlying cause of your problem first time. And that would make sense. Now, normally, if you're talking about anything on this Merrick chart, and again, if you'd like this, just jump into the club and I'll give it to you. I'm just going to say, well, that makes sense because this nerve goes to there. And if there's irritation of that nerve, does it make sense? It could be causing headaches there. And they'll go, yeah, like, why didn't anyone tell me that before? So it's a really simple thing to do. So I'm going to just connect it to the chief complaint. Then I'm going to look at motor, sensory, and autonomic. So oftentimes, if you do have a subluxation here, foregone conclusion, we may also notice sensory. So what else sensory along with headaches might they notice? Well, they might have along the greater or lesser occipital nerve irritation, especially they brush their hair, feels like a sunburn or like a spider bite, something like that, right? Could be sensory along those lines. Motor, nah, motor is going to be brachial plexus and lumbosacral plexus, and that'll be weakness. So mostly it's going to be sensory here, and it's going to be autonomic. So oftentimes, if you do have a subluxation here, we may also see when you brush your hair, blah, blah, blah. Well, that makes sense because this nerve goes to there. Do you ever notice spaciness, dizziness, mood swings, brain fog, eyes, ears, nose, throat, sinus issues, ADD, ADHD? Do you ever notice any of that? Why, yes, I do. Great. Can you take your pen, give them a clipboard, give them this, give them a pen. Can you circle C1 for me? Do you see how engaged they get? Can you circle headaches for me? Can you underline any of these things? Well, I get sinus issues all the time. I get snoring and sore throats all the time. Underline those for me. It would make sense because these nerves don't just go here, but they also really affect everything in here. Do you see how we're making the picture bigger for them? Right? Now I'm going to go down to another area. Let's say T4. Now, oftentimes you're subluxated here. We may notice something going on right between the shoulder blades. Do you ever get pain? And you just feel it. It's tender. Is it tender there? Yeah. Do you ever get any pain in between the shoulder blades? Yeah. Like especially at work when you're typing? Yeah. Does it get worse towards the end of the day? Yeah. Then you must be subluxated. Right now, if I was to look at sensory, what might they be experiencing? Well, it could be pain in between the shoulder blades. It could be radiating pain around the ribs, right? The intercostal nerves. Would I talk motor? No, I would do that down here or down the leg. Numbness, tingling, pain, weakness down the shoulder, elbow, arm, hand, fingers. If I was talking about this, right? But if I'm at T4, it's really going to be gas, bloating, indigestion, heartburn. So remember, there are plexuses. That area we know on the Merrick chart can go to the gallbladder, gas, bloating, indigestion, heartburn, right? But it can also be affecting stomach issues, spleen, immune system, pancreas, digestion, sugar handling, right? So when you look at this chart, you'll see this is blue and this is yellow and that's green. Down there, it could be affecting any and all of these. So I can just find one or two of these, have them circle and underline, and then before they go home, go through with a fine-tooth comb. And I can tell them, I'm going to correlate this with your rest of your examination, your x-rays, your scans, your electromyograph, thermograph, your heart rate variability, your brain scan, like whatever it is that you do, I'm going to go ahead and correlate those findings, right? So it's a really simple, easy process once you learn it. Now, again, I'm going to dive into extreme detail. In the club, we are in Zoom and we're having a conversation. I'm not just lecturing at you, and it's a full hour discussion. And I make sure like nobody gets off that call without fully knowing that they can go do this, right? So we can connect it to motor sensory autonomic in each area. We can connect it to their lifestyle, right? So interesting mid-back kind of thing. Do you do, what kind of sport? I do golf. So you're doing a unilateral kind of sport. What are you doing for your cross training, right? Could be talking about their digestion and what do you eat, right? So I can really connect this to their lifestyle. I can connect it to the 3 dimensions of stress, right? So mental, emotional stress, biochemical stress, and physical stress. So you've got this poor diet, right? I can connect it to anything I want, but it's all going to come from, oftentimes, if you have a subluxation causing blank, we'd expect to see blank, and that would make sense because blank. Now, the last thing that I'm going to do is I'm going to connect it by proving my case. So oftentimes, if you do have subluxation here, and clearly you do, causing your headaches, sinus problems, pain down your arm, sugar handling issues, mid-back pain, indigestion, we might notice a limited range of motion. Do me a favor, turn your head to the left, turn your head to the right. Wow, do you feel that it's stuck to the right? Yeah, well, when you're subluxated, that makes sense, because when you're subluxated, that leads to a lack of range of motion. No, that's called circular reasoning. When you're subluxated, that nerve interference causes your muscles to pull on your bones to protect the area so it feels stuck and tight. Do you feel stuck and tight? Yes, I do. Then you must be what? Then I must be subluxated. Now it's their idea and not my idea. The last thing I need to do, and it's on the brochure right here, is walk them through the whole story. Now, I don't have time to go into that right now. We will do it in the club. But basically, I'm going to get them to say this out loud. I know where my subluxations are. Now, remember, how do I know they know? because they just took a pen and they circled C1, C5, T4, and L5, right? If you're doing brain work, might have brain lobes and the emotions or what it would cause. If you're doing, contact reflex analysis or NRT, you would have, the picture of the reflexes and the symptoms. If you're doing acupuncture, you would have, so all the doctors I coach, whatever they do, they have ones like this. We make up a merit chart similar to this for whatever it is that they do. So I'm just going to say, so where are your subluxations? How do I know that they're going to know? Because they just circled it. They'll go C1, C5, T4, and L5. You'll say exactly. See how they own that? And what could those be causing? My headaches, my sinus problems, my sugar handling issues, the pain down my arm, the carpal tunnel, the gas bloating, indigestion, the heartburn, the urinary issues that I'm having, I pee when I sneeze, my sexual dysfunction, my PMS, the pain down my leg, whatever it is that they've already circled and underlined, right? So where are subluxations? What could they be causing? And what probably brought them on in the first place? Well, that would be the lifestyle stress that we did in the consultation. Remember, we talked about that last time. What happens if you don't get this taken care of? This is not my time to try and scare the hell out of them. This is my time to just ask them, what do you think happens if you don't get it taken care of? And they'll go, well, I think things would worsen. I think things would worsen. You say, I'd agree. You're agreeing with their story, right? If you remember the neuroscience communications, we're getting it past the reptilian brain to the neocortex for thinking, reasoning, and problem solving. And it drops into the limbic system as a new belief system. That's what's happening here, right? And then I'm just going to say, so on the other hand, if we were to correct your subluxations and show you ways not to recreate it, how do you think you'd feel? Well, I think that I could feel better. We could prevent problems in the future. I could be healthier in 5 years than I am right now, and I could have a better life. So you tell me, neck pain, headache, sinus problems, indigestion, coated tongue, stinky armpits, explosive diarrhea. Is it just a back problem or a health problem? What do you think? I think it's a health problem. I'd agree. So again, if you like that concept in the club, I'll be going through that in detail. You can go ahead and put club below and I'll get you in there for free. This is the foundation, your examination. And look, if you're a therapist, you're going to touch on their symptoms. You're going to touch on what you think is going on, not actually going to touch them. For most of us, we're actually touching them. We might be doing acupuncture pulse diagnosis. We might be doing reflexes with muscle tests. We might be doing palpating of subluxations. We might be doing scans on brain scans, neurofeedback, like whatever it is you're doing, you can use this oftentimes if you've got brain imbalances, oftentimes if you've got neuroemotional issues, blah, blah, blah. Here's what we would expect to see. Okay, I hope you found value in that. I'm moving over here. If you are there, please let me know. If you have any questions, please let me know. Remember, there's a bit of a delay right here, right now. We got Dr. Danielle. Do you sell those flyers for us to use with each patient? I absolutely do, so that they can circle it. You know what I'll do is I'll put the link where you can buy these and posters and all kinds of things. What I'd really recommend is just go into the club, because I give it away for free in the club. But if you want to buy it from me, you're welcome to. Thanks, Best Communicator. Thanks, Dr. Joseph. I sure appreciate it. Okay, so listen, gang, I hope you found value. Please let other people know about this if you found value. It's really simple, easy stuff. Over a third of the practices that I coach right now are fully waitlisted, anywhere from weeks in advance to months in advance. The longest in advance is a year and 10 months before you can get in as a new patient. People want what we offer. They're looking for help. Don't be the best kept secret in town. Okay, hope you found value. Next week, we'll be looking into the report of findings, where we'll be diving into this. And of course, in the club, we give that away. So, as always, much love and aloha. Bye, gang.